back normal. And we would not know what to do, because in medicine, we are taught that a patient comes to us, we take their history, we take their symptoms, we map and we do some tests on them, we do some investigations, and we map those findings on a disease process, and then we treat that disease. But then this was something that we could not treat, because yes, you have symptoms, but your tests are normal, so there's no disease that we can treat. And it was very frustrating, because I personally didn't have answers for these patients. And what we ended up doing was really treating their symptoms. But treating their symptoms were not getting to the root cause. So the patients would keep coming back, more and more, looking for answers which we did not have. At the same time, I also noticed in my practice that people would come in with real disease, where tests are abnormal, investigations are abnormal, and people are suffering. But when you look at the timeline, there was a pattern that emerged, that there had been something going on in these people's lives. And at that point, I noticed that disease is predictable. It happens at certain points in our lives. And what is predictable is also preventable. At the same time, I was part of that story. I became ill, I was sick, and being a physician, of course, I was worried, I was concerned, and I saw many doctors, and we did a lot of tests. There were abnormalities. For me, we even had abnormal tests and abnormal symptoms. But we could not nail down what was causing this illness. At the end of it all, I had to be out of work for 2 months. And I know most of you don't know this, but I had to be away from work for 2 months to try and get to the root cause of the problem. And still we did not. And I had to do some very advanced tests, like a bone marrow biopsy, to rule out cancer. But I didn't have it. But I was not well. And so a lot of things had to change in my lifestyle. And sure enough, I went ahead and recovered. And so given all these stories, given the patterns I had observed, I really got curious. And I got into trying to find out what exactly is going on. And that's when I delved into mind body medicine. And sure enough, I came to learn that there is a science behind how the mind and body interact to influence our health. And also, I realized that there is hope. A lot can be done for people to heal and to give people the power to really keep good health and live full lives, because what we know is that when people get sick, regardless of what you're doing, regardless of the amount of income you make, regardless of what is in your life, you cannot live a full life. So health is really the cornerstone of a fulfilling life. So this became a critical thing that really had to be addressed. And that is why I went down this road and founded Minders Medicine Institute with a goal to create awareness about how the mind interacts with the body and what can be done to prevent the patterns that I was seeing. Do you want to move on to the next slide? So the real symptoms that we notice is that there is a lot of anxiety that cannot be explained, fatigue, chronic pain, brain fog, chest tightness, dizziness. These are very, very common symptoms. What I also noticed, and I also noticed that from other literature, is that these symptoms tend to affect multiple systems. It's not just you just have pain. You may have pain, maybe back pain, but then you will also have another system, another organ that is involved. You may have gut issues. You may have high blood pressure, and that comes out of nowhere. You may get headaches that comes out of nowhere, and then you may get a CT scan, an MRI brain scan that shows that all your organs are normal. So there is a pattern, and there is a syndrome that has been identified that sometimes leads to these unexplained health issues. And so, yeah, we've already talked about that illness really comes at specific moments. And what is noticeable, and this is something I notice in my patients. So I work in the hospital. And for you to get admitted to the hospital, you must be really sick. It's not that you go to the emergency room and you're told go back home. you get to the emergency room and some tests are done, or just from how you're presenting, we decide you're very sick, to be monitored in the hospital where you have doctors monitoring you 24/7. So it became very serious. And when I talked to these patients that are admitted in the hospital, I got curious and I started to ask them, what is going on in your life? What has changed in your life? Has there been any significant event in the last 6 months, in the last 1 year, in the last 2 weeks, so the timeline varies. And sure enough, 60% of these patients that come to the hospital can tell you of an event that happened in their lives in the recent past. Again, the timeline could be, oh, yesterday something happened, last week something happened, a month ago, 6 months, all the way up to 1 year or even more, or 2 years. So let's keep going. Next. So yeah, the timeline is varies depending on the person. But the other thing I notice is that most people are not really aware, and many people would deny any correlation between this. But there was also a group of people that was very self-aware. There was a group of people that could tell, yeah, maybe this is what's going on. I have noticed that maybe if I'm not able to pay my bills, I suddenly start getting these migraines attacks, you know. Some people may tell you that I have noticed that when I'm not in good moods, then my body doesn't feel well. And this is some of the evidence we have that the mind and body work as one. And they influence each other in a bidirectional way. What happens in the mind reflects in the body. What happens in the body influences the mind. So using this bidirectional relationship, you can use the mind to heal your body, and you can use your body to heal your mind. Case in point, every time you go through something, I recently lost my dad in January, and I noticed what changed in my body. All of a sudden, my body was very numb, and this was a real experience. I could not feel anything. I felt like it was like I became numb all over. At the same time, my body felt so heavy. It becomes such a nuisance to drag it, get it out of bed, get to do anything. I lost interest in a lot of things, and at the same time, I could not find joy in whatever was going on. But then, so that was just the grief. The grief was manifesting in my body. So you can tell something that your imagination or your understanding, your meaning, the meaning that you make out of a situation will reflect in your body. Because honestly, death is something we know will ultimately happen to all of us. We know that intellectually. I know I'm gonna die at some point. I'm not ready to die. I don't want to die. But I know that it's gonna happen at some point. Yet, for all, death causes the most pain and psychological suffering. Yet, it's something that we all know. So this is why we are saying that despite knowing things intellectually, we don't know how to work with it. So that happened in the mind, but what can you do with your body? There's a lot, for me, what I started doing with my body, I started actually, this is something that I've been teaching, so it was a little easier for me to deal with, because I knew that I could use a breath work to regulate what my brain was going through, what my mind was going through. I could use movement, like what we just did. My body was frozen. It didn't want to move. So you know that it's happening because of this event. So you, with intention, you get out and will that body to move, make it move. And sure enough, when you do that, something changes in your mind. So it's not hopeless. There is so much that we can do to change this narrative. So yeah, we have talked that, so the conclusion from all this observation and research is that our psychology really influences our physiology, which really means that our mind influences our body and how our body functions. We're gonna go through, and this is something that has been observed many times. I'm sure even all of us, you have observed something. You may even have told, you have asked somebody like, are you stressed? When people tell you, I'm not feeling well, you may ask them, are you stressed? Maybe you know there's something going on in their lives. So we know it, and it's not a new thing. Hippocrates, which is really the founder of medicine, noted that it's far more important to know what person the disease has than what disease the person has. Why is that? Because context matters. Even when we get sick, we need to look into the context, what is going on in your life that may be related to what is going on in your body. And that is what we need to learn. How do we stop what is happening in the external world from affecting our inner world? All right? So the discovery is that your body, even when you get sick, is not broken. The system is dysregulated, and we will see why. Our bodies are controlled by the nervous system, not just the central nervous system, there's also the peripheral nervous system. So the nervous system controls everything we do in our bodies. Whether we're able to eat, whether we can walk, whether we can talk, all that is controlled by the nervous system. And when that is messed up, really your body will not function as normal. The code is corrupted because we have a software. The software is the mind. The body cannot function without the mind. The mind is like the software of your life. So imagine a computer. The computer has the hardware. It is the physical structure of the computer, right? But for that computer to function, it must have a software where you input details and you get something out of it. You get output from the input you give, right? So the software of our lives is our mind. The hardware of our lives is our central nervous system. Now, the hardware is something tangible because the brain is tangible. The nervous system is tangible. The software, can you see the PowerPoint? Software, you cannot see it, you cannot feel it. That is, how the mind functions as well. And we say that, yes, there is so much we can do, there is hope. So the big question is, what can we do? Yes, we know that all that is going on. What can we do? So what I would like us to do is really to understand the science behind it. Before we get to what to do, let's understand why. Why are we doing that? So that we have a baseline foundation, so that you don't feel like you're doing things in vain. So what we can do is first understand the science. We've already talked about the mind being the software and the body being the hardware. This is not something theoretical. This has been proven by science. And there are there's a lot of evidence regarding this. We have the HPA axis, which you will look into, neuroplasticity. Neuroplasticity really means that the brain can learn new habits. We've always maintained that you cannot teach old dog new tricks. It turns out that you can teach old dog new tricks. And this is the neuroplasticity that we see in the brain. That is how we can change habits. But at the same time, it's because of neuroplasticity that we maintain habits. Because the brain learns patterns, and then it keeps repeating the same patterns. Then there is polyvagal theory. Let's move on. We're not going to waste a lot of time in the science, but we're going to touch on the basics. So this is what the nervous system looks like. So the nervous system is comprised of what we call the central nervous system and the peripheral nervous system. The central nervous system is simply the brain and the spinal cord. The brain and the spinal cord. And then the peripheral nervous system is everything else. It is all the nerves. It is, and what we call the ganglia. These are a collection of nerves that control our bodily functions, like the heart rate, like our digestion, like our energy control. Now, when it comes to the peripheral, everybody understands about the brain and the spinal cord. That is very critical. Now, when it comes to the peripheral nervous system, we have two systems, autonomic nervous system. It means that it is beyond your control. And then we have the somatic nervous system, which is really what controls your voluntary actions. I can move my hand. But how much more control of my body do I have beyond that? Many times we think we can control our bodies, but can you control how your heart beats? Can we control your breathing? Yeah, maybe. I like that. Maybe you can. you know? So we think we have a lot of control of our bodies, but most of it we do not. It's beyond our conscious awareness. And that is for a good reason. Can you imagine if you had to remind your brain, your heart to beat? If you had to remind your heart, hey, now beat, right? We'll not be here. So all this exists for a reason. And then we have, this is very, very important, the autonomic nervous system right there. Very, very important, because that is what, it is what shapes what we'll look into further, the stress response. That is divided into sympathetic division and parasympathetic division. The sympathetic division is what activates anytime we face stress or we face danger. The parasympathetic division is what activates when we are relaxed, and it promotes healing, it promotes rest, it promotes digestion. Okay, you want to go to the next one? So yeah, that's the peripheral nervous system, and next, the autonomic nervous system. Back to the autonomic. So I want you to notice something about the autonomic nervous system. It is what maintains a balance in our bodies. It is what maintains our physiological functions in a balance, regardless or despite changing external environment. It is what makes you sweat when you go outside in the hot sun. It is what makes you know that, hey, it's cold, I need to get a blanket. It is for your energy conservation, your energy regulation. It is what regulates your heart rate, what regulates how your heart functions, your heart beats. That's what's called cardiovascular function. It regulates how all your organs function. The autonomic nervous system. It is also what gets activated when the brain perceives that there is a threat. Do you see now the correlation between stress and sickness? That you perceive there is a threat or you face a threat, the same system that regulates your organ function is the same system that activates. So you can clearly see that stress is not something you think about. It's not something that is in the air. It is not just a feeling. It is a change in your physiological functions. It is a change in how your heart functions, pretty much how all your organs function. Not only that, your immunity. Let's see the next slide. So we'll come back to this one next. Now, there's a branch called psychoneuroimmunology. This is a very detailed slide. But psychoneuroimmunology is the study that shows how our thoughts, our emotions interact with the nervous system to affect our organs and our immunity. Notice our thoughts and emotions interact with our nervous system to affect how our organs function and our immunity. Psychoneuroimmunology really focuses a lot on immunity because immunity is really our protection from any onslaught from the external environment. So when you get an infection, your immunity is really what makes you recover from that infection. So what has been shown is that you can see our thoughts, our psychological factors, thoughts and emotions affect our nervous system, which affect our endocrine system, which is really our organs, affect our immunity, and then that happens through the autonomic nervous system. So what we see is that our immunity really changes when we are stressed or when the nervous system stops functioning well. What then follows is that we see diseases arising. We see autoimmune diseases. We see infections. We see lowered immunity. We see cancer. Why cancer? Because cancer, we always have cancer cells circulating in our bodies. All of us do. But when you have an intact immune system, it takes care of those cancer cells. But when your immune system is not functioning, what then happens is that cancer happens. So that is very key, and that is why there has been a lot of focus on all this, because it's not just a mental thing, it is really something to do with your life. So let's go back to the previous slide. So this slide is really an explanation of what happens when we are facing stress. So stress response is something physiological, and it produces measurable effects in the body. even when you don't feel it. You may have gone to the doctor and the doctor may have told you, hey, are you stressed? You need to reduce the amount of stress in your life. And you're like, no, I'm not stressed. Some of us sometimes get annoyed. Like, why are you talking about stress? Because there are changes we can see even when you don't feel it. So you don't have to feel it, but your body is changing all the same. How does it get activated? It gets activated every time we are facing a threat, like an illness. When we get sick, the stress response is what helps us recover from that illness. It is what gets activated when we are facing a threat, like a tiger. If a tiger appeared out of here, you would run faster than you ever thought possible. It unleashes unknown powers within us. Why? Because it exists for your survival. Now, the problem is that your brain doesn't know the difference between perceived threat and actual threat. If you imagine that, hey, my boss tomorrow will be so upset because I have not met the deadline, that is a message of threat to your brain. The system activates. The same way it would activate if a tiger was chasing you. Do you see how ironical that is? So your mind, that's your thoughts, activate the stress response. So when there's a stress and we face that stress, whether it's perceived or actual, several parts of the brain respond. The key is the amygdala. The amygdala is a small almond-shaped organ that exists in the brain, and that is your threat detection system. When it kicks in, it has sensed the threat, it kicks in, it then activates the hypothalamus, and then from there on, it's a chemical process, okay? It's not a physical process, it's a chemical process that then causes changes in your body. Now, a lot of hormones are produced, we're not gonna get into the details, that then produce changes in the body. One key thing is that your nervous system primary goal is your survival. It's not your happiness. Your brain doesn't exist for your happiness. It does help in some ways, but it doesn't exist for your survival. It doesn't exist for your happiness. It's mostly for your survival. So what the amygdala does, it overrides your thinking brain. It overrides your prefrontal cortex, which is the part of your brain that thinks, that solves problems, that reasons, that is responsible for logic. That is why you may notice that when you get stressed, all your education goes out of the window. You cannot solve problems. Have you ever noticed that you're stressed and you're doing 2 + 2? Is it 5 or is it 4? Math solving problems go away. And then at the same time, your memory gets affected. Because right now, your brain is preoccupied in looking for the threat. So your brain is now scanning your surroundings for where the threat is, because it just wants to keep you surviving, right? It doesn't matter whether you're happy or not. We are living, the heart is beating, you're breathing, we are good to go, right? So you may notice that about the memory. Have you ever looked for your glasses when they are on the top of your head, right? This is something common. One story that is told, I remember a colleague of mine shared this story. She had a client, and it was a 24-year-old college student. And she shared the story because it was very remarkable. She, at some point, started looking for her phone because she could not find her phone. She was all over the place, looking for the phone, looking here and there, and she couldn't figure out where her phone was. But guess what? She was using the light on her phone to look for her phone. She turned on the spotlight to look for the phone. So that is exactly a sign of a stress system, a nervous system that is sensitized. Your memory disappears. Your awareness goes away. Your clarity goes away. You don't even see your options. And at the same time, many other things happen. If we could move on. Next one. Okay, never mind. So we don't have that slide. But so a lot of changes happen to the organs, and I'm going to cover that. I don't know if I have that diagram. It would have been easier. But a lot of changes happen to your organs. we're going to start with we just said your memory is impaired, your vision changes. That's why you can't even see things. Your vision becomes selective. There are changes in your eyes so that you are only looking, you have tunnel vision. You are looking for that lion and for that tiger because that is how this system developed. At the same time, your hearing is selective. Have you ever been in a conversation and then you finish the conversation, you can't remember a single thing that was said in that conversation? At home with your loved ones, you're discussing things and you're like, what did you say? What was that about? You have selective hearing. And the kind of hearing you get is that your ears become tuned to the low rumble sound. Imagine the growl of a lion. So you'd hear those sounds more than anything else. Maybe this is why females, we may complain a lot that our spouses do not listen to us. Because if they get stressed, we have high frequency voices, right? We produce high frequency sounds. They won't hear that. They are more tuned to hear the low rumble sounds. Your heart rate increases, blood pressure goes up, your muscles, they tense up because you're ready to fight. At the same time, blood is shunted away from the gut to go to the big muscles because it's a threat. We are either fighting it, we are running away from it. Okay, so we need a lot of blood, a lot of oxygen, a lot of energy in our big muscles to give us the power to fight the threat. That is why we have heard stories of mothers who are able to lift a car to release a trapped child. So you get extraordinary energy when you are stressed because your glucose levels you have glucose released from the liver. So you are very energetic at that point. You may notice when you're angry, how do you feel? You feel like you can take on the world. When you're angry, there is energy that is there's a reason why that happens. It's not just out of nowhere. It is your body empowering you and charging your system to fight this threat. So the gut suffers the most. At that point, we don't care about digestion. All we care about is survival. And that is why people who have chronic stress may experience gut issues. Gut symptoms, it's a very, very common sign of chronic stress. Not that it's the only cause of gut problems, but it's because we know very well that the gut functions suffer when we are chronically stressed. So that is the stress response. So what happens in our lives, in this current life? Do you feel like you're stressed? Do you feel like any of this applies to you? Because the current tigers are our bosses, the current lions is our work, it is our partners in the house, the people we live with. It is our children if they're not listening to you. It is your neighbor. He's playing loud music and that triggers you. It is the traffic. It is unpaid bills. It is a mortgage. It is AI that creates a lot of uncertainty about the future. It is our past experiences where we keep going back and reviving old memories. All these things are happening at the surface of our minds. So we are constantly thinking about these things. Thinking about them is not wrong, but how are we thinking about them? Anytime you think that you're not able to handle your life demands, anytime you feel that you're not empowered to deal with what is going on in your life, anytime you have regrets about what happened in the past, anytime you start blaming yourself about something you do not know that you're supposed to have done, anytime you start blaming others for your unhappiness, you are giving away your power. And the brain gets the message that, hey, we cannot cope. There is the threat. Anytime the brain gets the message that I'm not coping, stress. We need to help you cope. Because if you don't cope, the message the brain gets is that, hey, what's going to happen? Are you going to survive? So the current day stress is, the modern life stress is everywhere and it's happening 24/7. So what is happening is that we are activating our stress response 24/7. So the alarm stays on. And so what is going on is that we are always chronically tense. Our heart rate is going faster than our baseline. Our blood pressure is higher than normal. When you have chronic tension, you have chronic pain. And then gut. You may have indigestion, bloating, irritable bowel syndrome. A lot of symptoms that happen, chronic headaches, migraines. Pretty much every system in your body gets affected. It's only that all of us present differently, but this is what is going on because the nervous system, which is really the command center of our lives, is chronically activated. It's not getting to rest, so we are always in the sympathetic nervous system and not, which is the threat fighting system, and not in the parasympathetic nervous system, which is our rest and digest. So what do we need to do? Let's go on. So we need awareness. We need to know how we are responding to threat. Before that, the next slide. Next one. So we need to know how we respond to stress. That's knowledge. You'll find a different with 4 Fs. So we have different reactions to our environment. And the first part in changing this narrative is to know how we are reacting to the outside world. And there are 4 main stress responses. 4 main stress responses. It is fight, it is flight, it is freeze, it is fawning. Keep going. So I want us to have the slide on board because it's going to help in... Yes. Keep going. Fawn, F-A-W-N. Fawning, which is more about pleasing. Keep going, please. Yeah, here is where we go. So we all fawn. So we all respond to stress in this way. So the threat has happened, and the brain has detected that we are undergoing threat, and now their chemicals are released. It's hormones, neurotransmitters, and then so these hormones and neurotransmitters enter the bloodstream, and then they are bathing every cell, every tissue, every organ gets exposed to these chemicals. What you get is bodily response. So there are there are 4 main types of bodily response. I want you to know is that you do not consciously choose the response to respond with. We do not consciously choose that one, but we all have a predominant way that we respond to stressful situations. The brain chooses which response to pick depending on the kind of threat. For example, fighting. The brain assesses the threat and decides, this threat, we can survive this threat. This is the threat we can fight, right? Maybe, for example, your children. You think your children, you can manage them, right? So how do you respond to it? So there's increased heart rate, you get that aggressive posture. Fighting is all about your upper body. So, you're flexing, there's a lot of blood flow to your shoulders are tensing because you're about to take on this threat. And you'll notice that there's a lot of gesticulation. You can even tell what the people you work with, their stress response. But the most important thing is to determine your own. If you get into an argument and you find yourself confronted, how do you respond? So there are people who are gesticulating a lot. It's a way of trying to appear bigger than your opponent. If you watch Nat Geo, there's this one lizard, I don't know the name of it, that the neck expands when it's faced with a threat. So it looks much bigger than it is because the goal is to intimidate the person who is attacking you. We see this with our bosses. They are yelling, the voice is high, so that you appear more superior, you appear more powerful. So that is the fight response. This is the bodily responses we see. The flight response is all about running away. So there is a lot of blood flow to our legs because running away is using our legs as humans. So you'll notice that people will tend to withdraw, start walking backwards. They'll be restless. They'll be fidgety. This is when you decide you have a meeting and you develop cold feet. You don't want to go to the meeting. And then there is a lot of fidgeting. There is a lot of, you'll notice people may be just tapping with a pen. It's a distraction. You want to get away from the discussion. If you are having a discussion with your boss and you don't like what they're saying, You don't want to be there. That is the whole goal. You will develop the urge to go to the bathroom, but you'll go to the bathroom, but really you do not need to go to the bathroom. So this is the nervous system moving you to escape this threat, which you have perceived to be threatening. Your boss, maybe your spouse, maybe your children, maybe your neighbor, maybe anyone. You know, this is pretty much what happens in our everyday interactions. Freezing. Now, freezing, the brain has assessed the situation. It has realized that you cannot fight this threat. You cannot run away from it. So you play dead. This is plain puzzle. And I think this is what I experienced when I lost my dad. I couldn't do anything. I can't run away from it. I can't fight it. My body froze. Could not move. So you'll notice that you're tensing up muscles. If you're in any situation, you look down, you don't want to look people in the faces, your chest is collapsed, you don't want to speak. You have a low voice. Maybe you have noticed when you're very stressed, your voice gets caught up in the throat. You cannot speak. It's not you pretending. It is your brain moving these things. And then shallow breathing, you're breathing in your chest, it's shallow breathing, and you're emotionally numb. You can't feel, and you don't want to do anything. So the goal of freezing is for you to survive this event so that you can live to fight another day. It's all survival. And then we have the fun. Freezing also, I have to go back to freezing, is when people faint. Yeah, we have seen people fainting in shock. It's the same process. It's an automatic process that is happening in the background. And then we have fawning. Fawning is, you cannot run away from this threat, you cannot fight it, you cannot collapse. You just need to survive. So you please people. So people-pleasing behavior, you over-apologize, you avoid disagreement, so you become very agreeable. You excessively compliment people because you want to get on their good side. And then you sacrifice your personal well-being. You fear rejection. You want to belong. So you do a lot of extra things to accommodate other people. And then you have difficulty saying no. You cannot say no. You have difficulty setting boundaries. We see this response in cases like when people get kidnapped. What do? You have to do what your kidnapper wants. You have to please them. You have to do everything that is possible to survive that situation so that you can escape it later on. So these behaviors are automatic. So we should never have any judgment whenever we see people behaving in a certain way, and we'll see why as well. And because you are being driven by the nervous system. The key thing I would like you to take away from here is that the nervous system is the command center of your life. And many things happen automatically, but it doesn't have to be. So, at this point, I would like us to just have some self-reflection. Thank you everybody for coming. Some self-reflection and see, because for you to change, you first have to be aware. You cannot change what you don't know. And I also want you to know that these things are so automatic that you probably don't even notice them. I didn't always know this. I did not. And I'll give you my own experience. When I moved into this country, that's when I did dialectical behavioral therapy coaching with young kids and young adults and young teenagers. And then I went into residency. And then when I went into residency, I noticed that I had this chronic pain in my shoulders. And I couldn't explain what was going on. And at the time when I was doing residency, we used to carry pocket books. Everything was not digital back then, so our reference points were really pocket books. So we had these pocket medical books, and then the stethoscope was on the shoulder and all that. And I used to think, these books are so heavy. They're pulling on my shoulders. And sometimes I would take them out and put them somewhere because they're causing me pain. Every time I would go home and I have tension here, and I would take Tylenol every now and then. And I lived like that until I finished residency, went into, practice and all, got license and all that. But it's only after I learned this that I knew that, hey, that was my stress response. Because one of my common stress responses is fighting. So, I fight, like I said, we all go through that. But my predominant is fight. So fight, there's a lot of tension here. Neck, And I would get tension headaches. I was always taking Tylenol every now and then, neck pain, shoulder pain, because a lot of tension. I'm ready to fight. You put me in an argument, I'm going to raise my voice. I will talk on you. And, you know, there's tension that I could not tell. So nowadays, once I became aware of my predominant stress response, I deliberately treat myself every now and then. You may find me walking and I'm just doing this, right? I'm hitting a reset. Because when it gets activated, unless you hit a reset, it just keeps going. So I reset by just doing these physical movements that tell me, okay, you're not fighting anything. This is just ordinary life. Relax. So what I would want us to know is to start to create awareness around our behaviors. This is the first point where you see how your nervous system is communicating to you, how your body is communicating to you. What are things that you do on a daily basis that sometimes at the end of the day you are like, why did I do that? Because you're not aware of it. You're being pushed by something in the background. Why did I behave like that? Why did I act like that? Okay? And you have any volunteers, do you see any response that you think your nervous system picks predominantly in your life? Yes, Grace. Fighting? Yeah, you notice that you tend to fight a lot? Okay, good, thank you for sharing. Anybody else?
I think mine is flight.
Flight? You want to go away and run away? Difficult concentrating? How does that show up in your body? Is that something you feel? Do you ever feel like tension anywhere? Do you feel palpitations? Do you, some, yeah? Palpitations? Okay. All right. Grace, do you feel, you are fighting. How do you feel in your body? How does it show up in your body?
I feel like courage.
Courage, you get confidence.
I'm not going to run away.
Yes. Yes, some confidence that you can't explain, right? And it's false confidence. I used to have it too. Some false confidence. You feel like you can take on anyone. Because there's a lot of energy in you, and this energy needs to be channeled somewhere. And okay, anybody else?
I'm a fighter.
You're a fighter? Nyabura is a fighter too? How does it show up in your life or in your body? How do you feel?
I don't run away from problems.
You don't run away from it. You face it head on. Okay, good. All right. Anyone else? Yes, Anne?
I am a fauna.
You're a fauna? You fawn? How does it show up in your life?
In terms of...
Yeah, what tells you that you are a fauna? Okay.
Like, it's almost like a problem solving.
Yes.
But it is self-sabotage.
So you're sacrificing yourself to solve other people's problems. I see. Okay, anybody else?
At that time, you can have a bond of two. Like, you want to fight, and then after some time you see it's not worth the fight.
That is what we want. It's not worth the fight. Now you are beyond awareness. You are at the regulation stage. You know this is how you're responding, you don't need to. Yeah. Exactly.
Because you could be fighting and the fight first,
you don't need to be fighting.
The threat. And it's not necessary. But I love the following. The following example is, I know we have a couple of one of the examples in the Bible.
Funny.
There's a time King David.
Yes.
King David, because of course a pastor has to give us speech.
Yeah, of course.
King David was facing a threat.
Yeah.
And then he pretended he was mad.
Oh, he was crazy.
Have you read that? Yeah, he pretended he was mad and he actually escaped. So I thought he escaped the threat.
Okay.
And he pretended that he had lost it.
Oh, yes.
And then they let him go. This fool, he was even drooling,
Oh.
But because the threat was
too much.
Eliminated.
Yeah.
So I don't know whether I could call it funny. I would probably call it a wise flight.
Flight, yeah. Maybe fidgeting where you're like, I don't want this to go on. It could be flight and fawning. Remember, you don't have to have any one response happening at one time. You can have a mix of each. Good. Anybody else?
So I fight. I mean, you're mentioning the neck tension.
Yes.
I think it's because I'm on the computer all day long. But it could be that I'm just constantly.
Yes, here like this.
Tense.
Yes.
But at the end of the day, my neck hurts.
Yeah.
And then for fawning, I think my husband does fawning. He agrees with everything I say.
Yeah, because if you have a fighter, he doesn't want the fight. Well, I'm just thinking, he probably doesn't want to face the fight because when you're fighting, you become a threat to the other person. So they don't want to go through that. So they will fawn to end this fight.
I
So,
see that interaction a lot with me and my husband. Like, I'm doing this, and he's just like, okay.
yes, and the good thing is that you'll notice this not only in yourself but in the people around you. And when you start to change, guess what happens? The people around you also change. Because, for example, of course my husband is here. For me, when I really stopped fighting, things change around the house. So when you change yourself, your environment changes, the people around you change as well. So it's like the way we say you educate one person, you educate the nation. When you change yourself, you change people around you. All right. Anybody else wanted to share? Yeah, Grace? No?
I'll say the
Fawning?
because I don't want to, sometimes I don't want to deal with it, so
Yes.
I push it under the rug, but then
Okay.
I suffered all the medical issues, and I went to the doctor, and he was going to put me on all these medications.
Yeah.
And then now the question I ask myself, will this matter 5 years from now?
Yeah.
And then if it doesn't,
Yeah.
then get out of my way.
Good.
Then I'm able to move on.
That's right. That's right. So yeah, fawning sometimes is really you just don't want to deal with this thing, or you don't want this. It's mostly when it involves another person too. You know, you don't want to deal with this person as a threat. But the key is that once you notice these things that you do, it becomes very hard to say no. You know, you just want people to be happy with you because you want to create peace. The peacemakers tend to be fawners. You know, you want peace around you. Why? Because you're feeling threatened by your environment.
Why have you, maybe when they ask, why have you put such a spiritual and a romantic image? What is the reason for the image?
So, well, yeah, because you want to be accepted by that person. You present yourself as somebody who is just agreeable, a nice person who is not a troublemaker. A peacemaker. You become a peacemaker, yes?
Graceful.
Grace what? Graceful, peacemaker, right? Loving, but you're not necessarily loving.
When you found the stars of losing anyway, that's something.
I want you to know something. There's nothing wrong with each of these. It's only when it happens unconsciously that it becomes a problem. When it happens unconsciously, it's a problem. I'll give you an example before we move on to the next stage. In my fighting tendencies, I used to yell at my children a lot. And it used to be a big issue. And I remember being in a church group where we were sharing, what are you working on? What are you working on now? It used to be a prayer group or a Bible study group. And I used to say, I'm working on yelling. I yell at my children a lot. Yeah? And I had noticed because my children started yelling back at me. That's when I noticed it's an issue. They were yelling back at me because, like I said, you influence your environment. So they were picking up this behavior. Maybe they were thinking this is the norm, okay? This is how we talk. Because children, they first learn from us. And so, and I kept going, sharing about this yelling, and nothing was happening. I'm working on it, and nothing is happening. But when I learned the things that we're talking about here, I decided to enlist some help. I decided to put reminders, because I want to change, I want to stop yelling. And my reminders became my children. I decided to become vulnerable. And I told them, you know why I yell? I'm not aware I'm yelling, and I cannot control myself. Can you help me? Anytime I start yelling at you, because I'll continue yelling, it's happening unconsciously, could you tell me? And at first, it was hard for them to tell me not to yell, because they're like, am I going to tell her and then she's going to yell more? Right? You're going to get into a loop of yelling. So initially they didn't tell me, but I kept reminding them, really. It really took a lot of vulnerability and telling your children that I'm not in control here. And then they kept reminding me. My son was courageous enough to remind me. And I kept working on it. And in the initial stages, I needed their reminder, but within about 2 weeks, a month, I could remember. I would now notice the urge to yell. So I noticed when I was about to yell, so I stopped now working on it and stopping by myself. Finally, do you know what happened? Later on, much later, my daughter told me, Mom, you stopped yelling. I had not realized that I stopped yelling. But they noticed that the yelling had stopped, right? Because what happens is that when you get into the systems that we're going to be talking about, how to change your life, you're going to initially put effort, you'll need a reminder, you'll need an alarm because it's unconscious. Then you'll get to the point where now you're aware, you're doing it with awareness. Then it becomes effortless. Now it becomes a different habit that happens without any conscious input on your part. And that's what happens with my yelling. But at the same time, doesn't mean that I cannot raise my voice to my children. I can, but now I can do it with awareness, because sometimes that's the only thing they listen to. So you can fight, but you are aware of what you're doing. The lack of awareness is what causes issues, okay? All right, we're going to take a little break here. But before we take a break, I would want us to just sit where you are and square out your legs. Make sure that your feet are fully planted on the floor. We're going to practice the correct sitting posture. And I'm just going to grab a chair here. So, correct sitting posture means that you must have the correct height of your chair where you sit straight on your sit bones. So the sit bones is even to a better word. You feel the very places. That is what you're sitting. Okay? So you're not leaning forward, you're still straight up. Your spine is straight up. Okay? Don't use the back support yet. In fact, this is not a good back support. And then your feet are firmly planted on the floor, facing straight forward and in line with your knees. And then you leave a little distance from your feet, from your chair, so that your chair and your legs are not squished on your chair. So there's some little distance between the edge of the chair and your legs. And you just sit like that, and you rest your arms on your thighs like that. And you feel like there's something pulling your head upwards. Your shoulders are squared over your hips. So you're not leaning back, you're not leaning forward. You're squared over your hips. And your neck, you look straight ahead, not leaning back, not leaning forward, straight ahead. Like you can see, you're looking right straight ahead. And then relax, but engage your core muscles, engage your belly. That supports your back, okay? So that is the correct sitting posture. It may feel a bit stressful right now, a bit strenuous. Maybe you're not used to sitting like that. But when you sit like that, you don't strain your back, and you start to adapt to awareness. You start creating awareness of your body, and you start to notice where you have tension in your body. So this is how we start to get into the language of the body and to get to connect with our body with awareness. Why did we pick sitting? Because sitting is something we do all the time. So if you want to start working on awareness, use the things that you do every day. So sitting is just that. So what I now want you to do is turn your palms upward, and just place them on your thighs like that, and just relax. Feel that you're relaxed. Shrug your shoulders. Pull your shoulders away from your ears, especially the fighters, but everybody really. Just pull your shoulders away from your ears and just relax. If it feels comfortable, please close your eyes. If it doesn't feel very safe, you can leave your eyes half open. And I want you to bring your awareness to your breathing. Bring awareness to your breathing, wherever you feel it the most. You may notice air going in through your nose. You may notice some warm air getting into the nose, maybe down your throat. You may notice your chest expanding, or maybe in your belly. You may feel your belly moving up and down. Just take a moment and notice where you feel this breath the most. Where you feel the breath the most, I want you to put all your attention there, your complete attention on the region where you feel the breath the most. If you're a beginner, I suggest the belly, because the belly is huge and you'll feel huge movements there. Don't change your breathing. Just let your breath flow naturally. Feel your belly. Keep your breath there. And just see how you feel. As we begin this experiment, I would want you to notice how you feel in your body right now. Try to relax. Don't put too much tension on your body. Notice how you feel generally. Then go ahead and put all your attention in the belly. And notice the belly going up and down. It goes up when we breathe in. It goes down when we breathe out. And just stay there for a few minutes. If you notice that any thoughts are coming up, notice that you're thinking about something. Notice what the thought is. Maybe how silly this is. Maybe anything in the past, in the future. But just notice and then put your attention back in the belly and stay there. If you notice any tension, any symptom anywhere in your body, maybe pain, maybe tension, just notice it. And then don't linger there. Go back to the belly or your chosen point of attention and keep your attention there. We're going to do this for 2 minutes. 2 minutes starting now. Now please wiggle your fingers and toes and gently open your eyes. So, how was that experience for you?
Tiring because I've not done it before.
You're tiring because you're not?
I got tired, but I didn't want to fight.
Okay.
You don't want to fight.
She didn't want to fight. That's amazing. So you're getting insight on what this is all about. When you start to accept reality, you stop fighting. And part of the training is you develop what we call strong determination. You may have sat there, and that is why I told you to adopt the normal sitting posture. And most of us are not used to a normal sitting posture. It will feel uncomfortable. But when you didn't try to change it, kudos to you. You're really changing your system because the brain wants comfort. It wants you to go to what is comfortable, what it's used to. But the way you start training it is at the point you notice the urge to get out of this discomfort. You stay with it, you strengthen that brain, you train the brain a new way of responding instead of reacting. Good. Anybody else want to share their experience? Yes, Jimmy, did you want to say something?
Well, there's a position, I guess, that you feel is more comfortable, the one you're used to.
Yes.
And the body just wants to get back there.
Into it, yeah.
And also, wandering of the mind, so it's trying to venture into other kinds of thoughts and all that.
That's a big one.
You know, I guess it takes a lot of consciousness to bring it back to think about breathing.
Yes, you'll notice that about the mind. The mind is hardly ever present. It's always jumping into the past and the future, right? Always past and the future. But can the body be in the past or the future? The body is always here. So one of the ways of training the mind is using your body because the body is present. You're dealing with the present reality. So you get the mind out of that regret, shame, embarrassment from the past, all that fear and worry about catastrophic predictions about the future, and bring it here where reality is, and that is one way to turn off the sympathetic nervous system. So just coming back to the body, you influence the mind. This is the mind-body interaction. You use the body to change the mind, okay? To train the mind, rather. You're not changing it, you're training it. Anybody else?
2 minutes was a long time because my mind has to do multiple things.
Yes.
So I have to calm my mind and focus on my body.
Yes.
Because if I don't, I felt like when is it going to be done? Then I had to focus back on myself.
Yes.
And calm down because I'm so used to going to one thing to the next.
Yeah, always running, right? Always, the mind is always in a chatter. It never quiets down. How do you quiet down? How do you slow it down? This is how you slow it down. And the mind doesn't like change. So it prefers the pattern of always, it's called a monkey mind. Because it's always here, always there, past, future. You want it to be here, it's going to your house, it's going to the workplace, it's going to this and to this, but you're not there, right? So for it to come back here, it's gonna feel like this is something I cannot do. This is boring, this is annoying. It will give you those meanings, those interpretations, because it wants to get back to its comfort zone. Why? Because it conserves energy that way. It prefers the pattern. But staying with the practice, what you do, you don't fight the mind. You cannot win. You just notice that it wants to do that, and then you gently, without judging yourself, bring it back to your area of focus. And with time, it changes, and you'll notice that you can place your mind on anything that you want because you have trained it to follow what you want at any one time. Any other experience? All right, we're going to take a little break of 15 minutes. We can walk outside. It's very beautiful outside. We have a beautiful park. And then we'll be back at 6:51. 6:51, yeah.